Well, hello everybody. Good evening. I hope things are going well. We'll be starting the show in a couple minutes. We're going to put some music on and let people join. We are doing a live stream on Facebook Live and YouTube Live and Twitch.
Get everyone in here. We've got great information today about vaccinations.
Yep.
You got yours?
Nope. I don't have mine. I'll talk more about that and which group I'm in. And living on a border city, there is all sorts of stuff going on, and there's all sorts of stuff not going on.
That vaccine rollout. Do you like it? Do you not like it? Is it good?
Nope.
We're going to talk about all of that today.
Share this out. Get more people to join. And if you're watching on a replay, that's cool. Good information. And also, if you're listening to it in your vehicle when you're driving around Fargo-Moorhead on 88.1 KPPP-LP, give us a call at our message line. Give us some feedback.
Oh, yes. I want to hear how people are experiencing the vaccine rollout in Moorhead, in Fargo, and in Minnesota and North Dakota in general. What's it been like for you? Smooth? Rough? Indifferent?
We'll see. Here we go. Rolling, rolling, rolling.
Welcome, everyone, to A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM KPPP-LP Fargo-Moorhead, where we are adding local color to your airwaves. Today, I am talking about Vaccination Day, V-Day. When is your V-Day? To me, Vaccination Day is like Victory Day. It's like Freedom Day. It's like beginning of the possibility of the hope of going back to normal day. Mm-hmm. It's the I don't have to be terrified of getting severely ill, hospitalized, and dying from COVID day. It means so many things to me. What does it mean to you? What does your vaccination day mean? What is it going to mean when you finally get vaccinated? Is that even something you want? Are you terrified of the idea of being vaccinated? I know some people are. We're going to talk about all of that today, what the rollout is looking like here in the Fargo-Moorhead region. We hope that we get a lot of comments, questions, and we will try to answer those that you send our way. We want to crowdsource information on what are the best practices and tips that you know of to get in front of the line, to get in a line, to figure out where you go to get vaccinated and to get your folks vaccinated, to get the people in your family vaccinated, your neighbors, your elderly, people with comorbidities, teachers, all of the people that really need to get vaccinated, frontline workers, now, as soon as possible. And we're going to discuss all of that today on A Mexican Crossing Lines. But first, I want to make sure that you know that we are a community low-power FM station that depends on the support of listeners like yourself. How can folks donate to keep our nonprofit community radio station going so we can get more information out to folks?
Well, Cindy said we are a nonprofit organization. We are non-commercial. So we rely on listeners and supporters to keep us going. We've been going on 4 years now, and we've been having each year being better and better, and this is no exception. We're in a pandemic, and we're still doing the work. We're still broadcasting 24 hours a day, and we're doing shows. Now we're about doing one a week, but we'll do many, many more and get back to a more rigid schedule. If you'd like to support us, you can go to kpppfm.com/donate, make a tax-deductible donation to our organization. The money will go directly into the operating of the station so we can keep it going. You can also support us on Super Chat on YouTube. Duke 1517 is a channel. on YouTube, and you can just hit the little cash button at the bottom and support us that way. If you want to just get a hold of us, you can call our message line at 701-566-0917. Again, that's 701-566-0917. Leave a message up to 3 minutes. We may use it on the air. If you want to tweet us at media_PPP. Email Cindy at kpppfm.com or me, Duke, at kpppfm.com. We're broadcasting on Facebook at 88.1 FM Fargo Moorhead, Duke 1517 on YouTube, and a Mexican Crossing Lines on Twitch. So there's lots of ways to get information to us and lots of ways to support us. And thank you very much for watching the show tonight and spreading the word.
I really want to emphasize that I would love to hear from folks. What are your experiences of going and getting vaccinated? I'm going to share mine with all of you today. Just to give you a walkthrough of what it was like, to get you kind of mentally prepared, and to give you some tips. Also, everybody has a different experience of the vaccine. I'm going to share with you what my experience of the symptoms or secondary effects of the vaccination and how I'm doing today. It's been 1 day since I was vaccinated, so I'm actually doing really well today, although yesterday I was kind of wiped out for a large portion of the day. So that's something that you have to plan for. If you think that it's just a matter of going and getting vaccinated and just go back to life as usual, that may not be the case. I mean, you might have to slow down and take some time to self-care.
Yep, that's right. And, we're not used to getting vaccinations when we're adults, As kids, we went through this, or I did anyways in my generation. They were poking us with needles left and right at school, all the time. And, my mother took care of our symptoms and knew what to watch for. But now, getting vaccinated, as an adult, it's something that I'm not used to.
I actually am, because as a person with comorbidities or, underlying health problems, as many of you know, I've shared that I'm a cancer survivor. But in addition to having an immune system that's compromised, I've also been an asthmatic since I was a child. I'm allergic to 101 things. And so my lungs are compromised. And there are other comorbidities that I think a lot of Americans fall under, such as heart disease, such as diabetes, such as a high body mass index, overweight, and those can all put you in a more dangerous, high risk situation if you were to catch COVID or one of its many variants now. And that puts you to higher risk for being hospitalized with a serious illness. And it also puts you in a higher risk category for dying from this. And incidentally, we've known this since the beginning, but now the data is starting to come forward about how many people are being hospitalized with serious illness, how many people are dying versus their numbers in the population. I'm speaking specifically about people of color. In California, for example, you have Latinos making up over 50% of those who have been seriously sick from getting COVID, and more than 50% of those who die from COVID. And they do not represent those numbers in the populace. And this is true of lots of different places. This also translates into who gets the vaccine. In Philadelphia, for example, a majority of the people are Black, especially in the city of Philadelphia, and yet they are not the majority of those getting vaccinated. The majority of those getting vaccinated are white people. And so these discrepancies in service and access to medical care, vaccinations, etc., and that coupled with the fact that people of color many times live in multi-generational homes where older people and people that have underlying conditions are more likely to be infected by one person in the home getting sick, which poses a greater threat to those who have school-aged children, which poses a greater threat to those who have people that are frontline workers in their families. And that's pretty much what's happening across the nation.
Oh, yeah.
The people of color are being more impacted in a negative way by catching the vaccine, by getting seriously sick from it, by being hospitalized with it, by getting killed by it. And now, during the vaccination, we see the same thing happening in terms of who's getting vaccinated and who isn't. And you looked up those numbers for Minnesota and North Dakota.
Yeah. And Cindy spoke about this quite often. In fact, yesterday when she was in getting vaccinated, she said she was the only person of color in the whole place.
Until the very end, there was one black woman that came in at the very end, right as I was going in to get vaccinated.
So I thought, well, let's have a look at how we're doing in Minnesota. We live in Minnesota. We live on the border of North Dakota, Minnesota. Let's look at Minnesota. So I looked up the stats today and thought we'd present them today. And if you look at Minnesota stats by race when it comes to the cases, the actual caseload per 100,000 residents, if you look at these numbers, the tall brown one is Native American,
Yeah.
and then Latinos, and they're huge. If you look at the white, it's like double the amount of people of color are basically infected more than white people, twice as more likely to be infected with COVID if you're a person of color in Minnesota. And then more startling is the death. Look at the
Wow.
deaths. The Latinos are dying at a rate 3 times more than white people.
Yeah.
And
That's about right for the whole country.
and
honey.
and it's like these are startling statistics.
They're
so
devastating.
Yes.
It's not just, it's not shocking to me. It's, the disparity in between people of color and white people in almost every facet of society is very prevalent. It's always been there. It's much more disruptive when you stop to consider the fact that there are a lot of folks that still think that this pandemic is a hoax,
Oh yeah.
that refuse to wear masks or social distance, and that they're putting other people at risk. And they're doing all of this under the guise of demanding their freedom. Freedom to what? Freedom to infect other people. Freedom to be careless with the lives of people that, they tell, including politicians, hey, if you're high risk, stay in a hole in your basement.
Mm-hmm.
Hide from society. Don't go out anywhere. While ignoring at the same time that frontline workers, that all of these different types of jobs that involve having direct contact with the public are done in large numbers in service industries by people of color. The very same people that you're telling that have a higher risk that should stay home, you want to demand to be at your beck and call at these businesses you want open for your comfort, including schools. Because people need the schools to be open so they can get back to work, so they can get back to life as, they had normally. But what does that entail? It entails putting teachers at risk. It entails putting the elderly family members and family members with underlying conditions in the homes of those children who are families of color at higher risk for infection, hospitalization, and death. So, we can't talk about getting vaccinated, vaccination day, without talking about the disparities between who gets vaccinated and who needs to be vaccinated. And then there is another hurdle. And that hurdle has to do with how do you get that outreach done?
Yeah.
In communities of color, that's not the easiest thing to do.
Mm-hmm.
So I wanted to just share, before I tell you what my vaccination day was like, I wanted to share some tips, okay? Some tips of what to do in communities of color, because I don't know. I think that the vaccine rollout, Duke, has been a disaster.
Yeah.
It hasn't been great. First, we did not have the doses that we thought we had.
Mm-hmm.
And then as we ramped up the doses, the infrastructure to give them to people was not existent.
That's right. And finally, when I was there was giant snowstorms and frigid cold across the whole country. Supply lines were cut off. Vaccines
Natural
were
disasters.
ruined. Yeah.
And the layers of, what this, means is that we're having to figure it out as we go. We're having to go, okay, well, that's not working. We need to figure out something else. One of the things that I've heard in the news in many states is that states are twisting themselves into knots to send the doses of vaccine that they have to whiter communities, more affluent communities. In fact, they're even investigating some people like Governor DeSantis in Florida for doing such things. And largely densely populated communities with high concentration of people of color are not getting as many doses available, which means they're not getting vaccinated in those communities. Not only that, but what they found is that those communities that are being sent the vaccine are being sent too much vaccine, that a lot of the people in those communities are not signing up to get the vaccine, not showing up for the vaccine, and then they have a surplus, which they have to throw away. In many places, in many states, there are counties that are throwing away hundreds, if not thousands of vaccines because of these practices. And then they're trying to scramble to figure out a way to get the extra vaccines to those communities of color in another area, and it's just a mess.
That's for sure.
Go ahead.
Well, and here in this community too, is I've obviously been following this because we need to get vaccinated. There's so many things you can sign up for it, and the rules keep on changing. They have rollout plans. Every state has a rollout plan. Minnesota is different than North Dakota. Yet we live on a border, and Minnesotans can go into North Dakota under certain rules, but there's different levels that are being treated. Like right now in Minnesota, for example, it's basically 65 and up, and first responders, they are doing a terrible job here in Moorhead with their outreach for this. 65 and up. Today, I looked at the open appointments. There was over 100 open appointments that weren't filling up. So they put this out telling people, attention, come on and get vaccinated.
How are they putting it out? On the internet, on Facebook?
Facebook, or you have to go to their website. And there's another big medical provider here called...
It's only for 65 and over right now. And a lot of those people who are not tech savvy, who may not even have access to internet, to be checking these social media pages or going to the website, a lot of those folks think someone is going to contact them because they're the priority. I mean, that would make sense to me. If I'm someone 65 or over and they announce on all the TVs that they're going to be giving the vaccine to the older people first, I'm waiting for a phone call.
That's right. Yeah, you're waiting for a phone call, an email. In fact, what's tricky when you go to the websites, you have to go to the county health department websites, and there'll be questionnaires from time to time. And you fill it all out. It's very lengthy about your health and all these different things. And then they say, well, we'll get a hold of you. And you're like, well, how? You're going to call me, text me, email me?
It doesn't tell you how.
They said it'll be by one of those ways.
Oh.
And also they say if you're a Sanford patient, if you're not, go sign up for My Easy Chart and fill out all that information. We did that.
Is it easy to fill out all those forms, Duke?
No. And then you got to create an account, and you have to do the authentication of your password and all the stuff. Once you're in, we did this in January 11th. We did this. So I kept on going back. Every time I saw a news story about this, I went back and I checked. Well, I got to go check the chart. And it's like crickets, not a single response. There was just a letter that they sent when I first filled this form out that said, we'll get a hold of you when the time's right. Then I watched Fargo, and Fargo, all of a sudden, they're into their next phase, which is the 1B phase. And this is like, it's 75 and older, 65 to 74, with two underlying conditions. If you're in nursing homes and all those sorts of things too. And also if you're 65 to 74 with one underlying condition, and adults 65 and older without underlying conditions, people of any age with two underlying conditions.
That's me.
Child care workers and preschool and K-12. That's all.
That's a lot of people. But then,
I know.
And then the next one, which will be 1C, I'm assuming, is National Guard, grocery workers, public safety workers, police, like I'm assuming, things like that. public transit workers like bus drivers and
But there's
blood
more.
bank workers.
There's
and
more. There's more than this in the sense of the trick to get in, because in Fargo, we have Sanford hospitals. We don't have a hospital in Moorhead.
There's no clinics really.
You
in
have to
hospitals.
have both your primary and secondary care providers in North Dakota, and
What if you only have a primary?
then you call if you're in Minnesota, you can't go. Also, you have to work.
What?
You have to work in North Dakota. There's these other things that make it so you can get turned away. Actually, what happens is you're discouraged not to even go, and that's what I think the problem is that
That really leaves Minnesotans that live in Moorhead on the border like us
yeah.
out in the cold, because there aren't providers on this side of the river. Everyone gets their health care in Fargo because it's the closest place where there's a hospital. That's the closest place where they have all of these clinics. So if they are trying to discourage anyone from out of the state, then all of the people that live in Moorhead that don't have access to medical care any other way
Yeah.
can't get a vaccine.
And
And the majority of the people in Moorhead work and travel for school or groceries or everything to Fargo.
yeah, and also a lot of people are employed right now, so there's tricky. And I understand what they're trying to do is make sure the most vulnerable people get vaccinated as quick as possible. And they're not doing a great enough job of getting 75 plus and 65 plus people. Like I said, the other things is each county has a questionnaire you filled out, and when I filled out the Clay County, which is a Minnesota side survey, and it actually is very extensive. It had this thing: if you had insurance, you had to fill all the stuff out. You had to scan the cards. You had to fill out all the numbers, and you had to take pictures of the card and send them in, even though I thought, well, I should have just said on there, don't have insurance, because then the federal government would pay for it. And I thought, well, that's unfair. We have insurance, and our insurance will pay for this. But it was really difficult to enter that. In fact, that insurance information almost made it so I couldn't fill out the forms because it wasn't accepting it. The name, it wouldn't accept the name that was really on there. So I shortened Cindy's name to just left off the Schempp part and said Gomez, and it worked, And then I had to say it was
my goodness.
me that has the insurance. It's actually in Cindy's name. It was just this
So simple.
it was simple, but at the same time, I understand the idea is let's make sure the most vulnerable people get the vaccine first, which makes a lot of sense to me. But the thing is, they aren't getting vaccinated.
No.
There's openings, and they're sitting
they're
on the
not
table with the vaccine getting warm. They have to use this stuff up.
They don't have a plan, a grassroots plan to get to people that are 65 and older,
Yeah.
that are eligible for the vaccine. Who's calling them? Who's making sure? See, what it seems like to me here is that we need to set up our own grassroots community outreach. If you're a person of color, if you have an elderly person in your life that you want to get vaccinated, a person with comorbidities that has underlying conditions that make them more vulnerable, listen up. This is what you're going to have to do. One, you're going to have to buddy up. You're going to have to put that person of color that has comorbidities, that works in the nursing home, that doesn't necessarily know how to navigate all of this, and set them up with, if you're their neighbor, if you're their friend, if you know how to navigate the interwebs, you need to buddy up with someone that you care about getting vaccinated. Look around your community. If you have the wherewithal to run a computer, to check up, to fill in the forms, to help these folks get to that first level of access, find that person in your family. I had to call people in my family. What's your vaccination plan? Do you have a vaccination plan? Where are you going to get vaccinated? When are you going to get vaccinated? Ask about the details. I'll give you a funny aside here.
Mm-hmm.
I was asking people in my family about when they were getting vaccinated, and I got, I'm getting vaccinated through some city program from my mom, and then later found out from my brother Raul that there was no such appointment, that when questioned about her appointment time and the procedures she had to go through to get the vaccination appointment, my brother found out my mom was lying.
Oh.
And that she was hiding the fact that she didn't want to get vaccinated by making up that she already had an appointment so she wouldn't have to get vaccinated. And so she wouldn't have to have a discussion about why she doesn't want to get vaccinated. So in the end, my brother had to bribe my mom with a free vacation, with a free airline ticket to Mexico once she got her vaccination so that she would agree to get vaccinated. I don't know what you're going to have to do, but it's not as simple as just trusting that some healthcare worker, some Department of Health was going to call your family members, your neighbors, your people in the community that are vulnerable. You have to do something about it. You have to care. Just start asking around. Call your family members and they say, hey, have you gotten vaccinated? What are your plans? How do you feel about it?
Yeah.
It might be a touchy subject because there's some people out there that do not want to get this vaccine, that are scared of this vaccine. And it doesn't matter whether you're black, white, Latino. There's fears about this vaccine in every community.
True. And also with my family, a lot of them live in North Dakota, in the middle of North Dakota, and they're getting vaccinated left and right. And my father's been vaccinated, my sisters, and everybody seems to be getting. And I'm like, how come everybody's getting vaccinated in my family? And I'm waiting for a call. I'm still waiting for Sanford to go to my easy chart and say, okay, it's time to come in.
In fact,
and
people in your family not only have gotten vaccinated, they've taken trips.
That's right.
All over the place. They've taken little vacations all over the place for which they needed to show proof of vaccinations or negative COVID tests.
Yeah, and that's something that we'll talk about in a little bit, but it's, it's Cindy got in because I was filling out the forms and it popped up that there's available appointments. I thought, whoa, and I think it had to do with she's had cancer, she has asthma, she has some of the pre-existing conditions that would lead her to be very vulnerable and should be up there, the 1B category, and even in the 1A. In North Dakota, she qualifies, but again, she doesn't meet all the criteria, so that's just not an option. And in Fargo, they're getting upset because they were showing a lot of people from out of state were getting vaccinated, and it's like, turns out most of them are from Moorhead in Minnesota, which you qualify, our health providers are there. My Sanford chart works for Minnesota residents, In fact, in the rural areas here, there's the healthcare system, there's not that many clinics. So it's very concentrated into the urban area.
So, number one, you have to care about the people in your family, asking what their plans are and having that conversation. And I know it's hard to talk about medical things because those are private things we usually just don't talk about. But have that intimate conversation on a private message, call them up on the phone and ask them, what are your plans? Once you get through that, find out what their access to the internet and their technology knowledge is.
Or you can also help out. If you have internet, you can help someone fill it out remotely. You can do it from your place and just, you can be doing, FaceTime or Messenger, video with them.
Ask, hey, would you mind if I help you? You need some help?
They'd have to show their insurance cards and insurance information to you and that sort of stuff. But, that's cool. They can take a picture of it and send it to you. And you could include it in the application. So you just got to help someone out.
Help out one person. And I hope that, if nothing else, if this encourages somebody that's listening to go, you know what, my neighbor's elderly, they probably don't know how to navigate this whole form filling out, checking back, refreshing the page, doing all of this stuff over and over again, sometimes for weeks at a time to figure out how to get on that first level of getting an appointment.
Yep.
And so it's incumbent upon us to do that. We have to care enough about the people in our family to have those. And I'm just going to take a brief moment to talk about apathy a little bit because I've seen this, especially among older people, especially among people of color. They're the folks that are just kind of pull yourself up by your bootstraps, or that they feel that they've been ignored, that they're not prioritized, they don't feel important. They kind of have a sour grapes attitude toward the vaccine. Like, nah, I don't really need it. Who cares? What's the point of trying to get it? I'm not going to get it right now. What's the point of trying to get it? It's going to be a big hassle and I have to make sure that I get to work. I have other better, more important things to do. It may feel like the vaccine is out of reach, and that's why many people may poo-poo getting it, because it just feels like it's so daunting. But if you stepped in and said, hey, what if I helped you? What if I signed you up? Then maybe they would. And lastly, you have to think about transportation. How are you going to get the person there? This might involve you telling that person if there's an appointment, if there's an opening, if there's a cancellation, if there's a bunch of vials that are going to go bad at the end of the day, I will take you to these places. This might entail you going to lots of different places over a period of days, maybe even weeks, and just hanging out, hoping that there's a possibility you can get vaccinated.
That's right. Even when I was filling out the forms, I started looking at places around Fargo-Moorhead within 50 miles. And so I signed you up at Detroit Lakes, thinking that, that some pharmacy is doing the vaccines in, I forget what's Thrifty Drug or someone.
That's a really important point.
And so I started signing up in other communities because I thought, well, we're in Minnesota, you don't have to be in Moorhead.
Nope.
And so I started filling those out. And, once, I don't know the system either. Once you started your vaccine and what you go into a database, I don't know. These people might be calling still.
Yeah.
And, we'll see what happens with that. But I took other opportunities in other communities to look that we might have to drive 50 miles. And also on one of the questionnaires, they said, can you act quickly and get someplace fast? And I thought, no, I don't want to get up at 8 in the morning and do this. And then I started rethinking that, like, we need to get vaccinated. We need Cindy vaccinated for sure, like as quick as possible. And so on the other forms, I said, yeah, we'll take whatever you give us.
And 2 important takeaways from that one, maybe 3. 1, don't try to cherry pick which vaccine you get. Okay? I know that there are some people out there that want a specific vaccine because they think it's more effective and they want to wait for that vaccine. Don't wait for a vaccine. Get vaccinated. It doesn't matter which one of these vaccines you get. If they're FDA approved, if they've gone through all their clinical trials, you know what that means? It means that if you have that vaccine, even if you only have 1 shot of your 2-dose vaccine, you are less likely to get seriously ill and die from this. And so you have to get your vaccine. The sooner, the better. Just get it. Don't cherry pick. Another important takeaway, don't put all your eggs in one basket. So sign up at multiple locations. Sign up at pharmacies. Sign up at the different community centers, healthcare departments, and clinics where the vaccine is being administered, and hope and pray that they call you. The third and most important, I think, is you have to be flexible. As Duke said, you have to be willing to get up early, to get a call at the last minute and run out and get in line. So with that, let me go through my experience. I'm going to tell you what I had to do to get vaccinated. First and foremost, you have to check, just like any other medical procedure, you have to get ready for it. What does that mean? Get enough sleep. I'll be honest, I was pretty excited the day before I was going to go in. So I was thinking about it all night.
Got up early.
On some level, I don't know. I was so excited I couldn't sleep as well as I normally would. But get enough rest, get enough hydration and food, all the good things that you need to make sure that your body is in its best state for the day that you get vaccinated. Get all of your things ready. You had a pile of things ready. What things did you put in the pile? We had my ID. You should carry your ID with you. Make sure you have your identification.
I had your medical card, your ID, and also I had a printout of the appointment.
Very important.
The address and the time. I remember when I dropped Cindy off because I wasn't going to go in there. There's a bunch of people, with their masks hanging off their face. I ain't going in there. Then Cindy says, "What time is my vaccine?" I said, "It's on your piece of paper. It's 10:25." And that she'll explain the process. That was very important to know when your appointment was for.
It's very important to know the exact time that you are having your vaccine because they schedule people in blocks. So, at least they did for this vaccination site. So I'm not sure that they're doing that everywhere, but you should know exact time of your vaccination. Make sure you have your insurance card, your identification, all of that good stuff so that if you're asked for it, by the way, I was not. I did not have any of those things requested from me, but I had them ready to go just in case. Also, hand sanitizer. your masks, double mask if you can. It's better. It's safer, unless you have an N95 mask. And make sure that you social distance even when you're inside of a building, which I was, as best as you can. And I would further recommend that you get out of there as fast as you can, because there's people that are congregating. And, you know, the first thing I noticed, because when we got there, you stayed in the parking lot, and everyone else was in line outside of the Gomez-Schempp. That's where I got my vaccine, at the Gomez-Schempp Center. And I thought that was really great because we were outside. So I thought, okay, well, at least we're in the fresh air. So, you know, there's not going to be a concentration of people's aerosolized breath. They're just hanging out inside of a building. But at some point, they brought us inside the building. For those that don't know, the Gomez-Schempp, it's like several different floors and layers. So we were in the first floor, and they spread us out on the first floor, and then they started calling appointment times. So all the people that had their appointment at 10, they were brought up to the front. They were asked a series of questions and sent downstairs to get vaccinated. And then the next batch of people. Interestingly, there was a lot of young people that were getting vaccinated, which I did not expect to see.
Yeah.
I'm assuming that those people were working in nursing homes or, you know, met the criteria in other ways. But those people were actually not as early as all of the older people. The older people were there early for their appointments, while the younger people showed up after their appointments. And then I was right behind a couple that was not, you know, the wife was not getting vaccinated. The husband was getting vaccinated because the husband was over 65. But this is the exchange they had. They walked up to the receptionist when they called the time, and it was the same time slot as me, 10:25. So they walked up there, and the woman said, "I'm not here," because all they asked was your name, and she said, "I'm not here to get vaccinated. My husband is. I don't qualify. I'm over 65. I'm not 65, but I would like a vaccination." And the receptionist looked at her and said, "Do you have any underlying conditions?" And she said, "Yes, I do." And she said, "Oh, well, then you can possibly get the vaccine. Why don't you go ahead and go downstairs with your husband and see if you can't talk to the health director so that they can approve you getting the vaccine?" So she took a chance that they were going to turn her away and say, "Sorry, you can't get the vaccine." And that's what I think everyone should do. I think people that want to get vaccinated should take that chance and go and find out. If you have underlying conditions, if you're working with vulnerable adults, if you have reasons why you think that you should be able to get this vaccine because you're at higher risk, you know, waiting in the places where they have vaccination sites to see if there's extra vaccines that they need to use up at the end of the day, going to an appointment with someone else and finding out if you can get approved to get the vaccine that day, waiting for someone to cancel so you can take their slot. Those are all strategies that could get you vaccinated earlier. And you should want to get vaccinated earlier. There are many reasons to get vaccinated as soon as possible, not the least of which is that you won't run the risk of getting super sick and dying from it. It also means the possibility to some kind of new normal. And, you know, there's a lot of discussion about the getting your vaccine. I was super excited to get my vaccine. I sat for my vaccine. I wore this sweater that has shoulderless sleeves so that they could just easily vaccinate me. I'm not wearing it today, but here's a picture of me at the vaccination site. And I was so pumped to find out that I got vaccinated on the same day as Dolly Parton. And Dolly Parton, she donated over $1 million to the development of this vaccine. So it's wonderful that I got vaccinated on the same day. And did you notice that she's wearing a top that is also shoulderless there? So, me and Dolly, we had the same fashion sense that day to wear the shoulderless tops and get vaccinated on the very same day. But you know what else I found out? The day before I got vaccinated, that Donald Trump, Melania Trump, Ivanka, Jared, a whole bunch of people in the administration, many of whom, just like Trump, had not worn their masks, refused to social distance, refused to have gatherings with maskless people by the hundreds, by the thousands. They got vaccinated in January before they left the White House.
And didn't tell anybody. It's just
Why
information.
do you suppose that was?
Well, people are guessing. They don't know why. But part of it was that they want to show that they're really concerned about this, and they didn't want to encourage people to really take it seriously and do anything about it. I've heard some newscasters talking a little bit of a narrative on reasons why they would have hid it from the whole country.
Well, I think it's similar to why Trump hid the fact that he was very close to be putting on a ventilator when he got COVID.
Yeah.
He downplayed the seriousness of his own illness. He downplayed how dangerously close he was to being put on a ventilator, and but for the fact that he got monoclonal antibodies, he could have been put on a ventilator and might have even died from this. It's because he wanted to appear tough, invincible, godlike to his many followers who do see him as that kind of person.
Yep.
And that's why he said, don't be afraid of it. Don't let it rule your lives. I'm fine. You'll be fine. Over 500,000 people dead later, a year after this pandemic started, we know that you should take it very seriously, that it's very deadly, especially to Americans, that it has been very deadly. So I was thrilled to be able to get my vaccine. I didn't take any pictures of myself getting vaccinated or my vaccinator, but I do want to thank Madison Klein, Maddie, as she told me she was called, was wonderful, answered all my questions, did a great job, and was one of the first human beings I've spoken to face to face in person.
Yeah, for a year.
For over a year. And I told her that I was like, I don't know if I'm so excited to be here because I'm getting vaccinated and this is going to be a huge weight lifted off my shoulders, or just to be in the presence of another human being. You're the first person I've talked to this close up in over a year. And I really wanted to thank Maddie, not only for, doing the great job that she's doing, all of the healthcare workers there. I don't know their names, but Madison Klein, you saved my life. You put that vaccine in my arm that's going to keep me from dying. So thank you. Thank your healthcare workers. Thank your vaccinators, because they're putting themselves out there as well. And we really appreciate everything that they're doing to make sure we stay alive. Now, what are the benefits of getting this vaccine? For all of the negative talk about the rollouts, and I have to tell you, not only do I feel better because I don't have to worry constantly about being hospitalized and dying from this anymore, even just with one dose, I can look forward to having reunions in the future with family members that have been vaccinated. Because when we're both vaccinated, you can hang out with people and you don't even have to wear a mask anymore. You'll be able to kiss and hug your family members if you get vaccinated and they vaccinate. And
also there's still research going on. There's been people who have been vaccinated who actually have gotten COVID.
Yeah.
And spread COVID.
Yeah.
And so there's a lot of things. We won't let our guard down. Cindy being vaccinated, she's the only person that's started in our household. The other ones of us haven't had that opportunity yet. When we do, we will take it. And but now our habits are not going to change. The things we're doing, the precautions we're doing, we're going to keep up until the day that this vaccination that Biden just announced that the rollout is going to happen by May. In 2 months earlier than anticipated because of some of the things that the War Production Act and some other things that have been put into place to produce a vaccine. And that's great because after that, according to Fauci, after you have, a high percent of the people vaccinated in the communities, it's going to be a lot safer. And we will have to weigh what we do for our new normal and our precautions we have to take. But also just something really interesting is that there's been pretty much no flu this year. The flu virus has not spread because precautions, washing your hands a lot. I mean, this is the day of washing your hands.
Well, I thought masks didn't work, Duke.
Well, for some reason, there's no flu this year. So, we didn't get vaccinated for the flu.
It's a miracle.
Yep.
Well, of course, we know that masks work. Otherwise, we wouldn't have eradicated the flu.
That's right.
And it just goes to show you that if we do the simple, basic things and we do them consistently, they can have a huge impact. So yes, we have to continue to mask up as always, not just for ourselves, but for others. And especially if you've been vaccinated, it doesn't mean you can't still get it and spread it. Mm-hmm. So don't forget, you can still get it and spread it. Just because you're not going to die doesn't mean you shouldn't avoid giving it to other people and making them so sick that they die. That's
right. And, there's another benefit of getting vaccinated is that, you're going to have a lot less chance you're going to get coronavirus and you're not going to spread it. If you're totally unvaccinated, there's this chance that you're going to get it and spread it. And that's one of the biggest things, that we need to be responsible around other people. And we need to not spread this disease. So that's another benefit of getting vaccinated.
Getting vaccinated, again, does not mean that you cannot get it. You can still get it. You just probably won't have a really severe case of it. And you probably won't end up having to go to the hospital or get be put on a ventilator or die. But if someone in your proximity is not vaccinated, they can get a very severe case from you, mm-hmm. and they can die.
Yeah.
So getting vaccinated will protect you. It'll give you more opportunities in the future. And that includes the future of the world. Folks, it's really important to keep all these precautions of social distancing and everything else because guess what? We're not isolated. It's not the U.S. It's the whole world, right? Mm-hmm. And this pandemic isn't going to be over, and we're not going to have a new normal because we hit herd immunity or we get to 80% of our populace being vaccinated. Mm-hmm. This pandemic is going to end when 80 to 90% of the world gets vaccinated.
Yeah.
Guess how much of Mexico's been vaccinated?
I know the answer.
I know you know the answer. But I want people to guess. Mm-hmm. You think it's less than 20%, less than 10%, or less than 5%?
I know the answer.
It's less than 5%, folks. It's 1%. Mm-hmm. And the reason is third world countries do not have a budget. I mean, heck, if AMLO did not have enough ventilators, enough PPE, enough hospitals, enough doctors, the list goes on and on. What kind of expectations can people in Mexico have of getting the vaccine? Mm-hmm. Let me tell you what the truth is. The truth is that most third world countries are going to be waiting for a first world country like Canada, the United States, or the European Union countries to give them vaccines, to gift them vaccines. And unless and until first world countries do that for other nations that don't have budgets to buy vaccines, those countries will continue to spread the COVID virus and variants of that virus that will put the rest of the world at risk. So until we do that, until we can get the rest of the world vaccinated, we are still going to have to take some mitigating precautions. Mm-hmm. Not the least of which is if you want to travel ever again outside of this country. We're going to have to get the pandemic under control. And other countries, which have all throughout this process had different rules, those things are going to inform how the United States does things in the future. I showed in past shows how North Korea and some places in China had put in all sorts of protocols to test people, take their temperatures, do all sorts of sanitizing and contact tracing, following people from every bus and taxi or Uber they've taken or subway ride to every purchase they've made, so that when you start showing symptoms, if you start showing symptoms, they can notify everyone in your proximity. Well, with the onset of this vaccine, guess what the new norm is going to look like? It's going to be having a vaccination identification, or as it's also being called, a vaccination passport. Here's what they do in the UK. Take a look at this, Duke. This is a vaccine passport.
Yep.
And what it means, this is proof that you've been vaccinated and that you are now not dangerous. What that entitles you to is not just traveling, okay? In many places in UK, and I believe this is going to go throughout the world, you're going to have to show one of these things to get into your gym.
That's right.
You're going to show one of these things when you go to church. You're going to have to show one if you want to stay at a hotel or if you want to go into a restaurant or a pub or a concert. Or a football game. So get ready, folks. The vaccine passports are probably a thing of the future. I think that it's going to be something that's going to make me as a consumer feel a lot more comfortable about going to any like stadium event or indoor venue like a restaurant or a bar.
Definitely.
Because honestly, as long as I don't know that the rest of the people around me aren't carrying some dangerous variant that could kill me, I don't ever know if I'll feel safe.
That's right. And, it's the passport. This is a new idea. There's a lot of pushback because, the vaccine has not been available to all people. So there's a bunch of people that haven't been vaccinated. And if it's implemented, it'll keep people safer. The people will be denied access to all these things that they should be able to have access. So there's been some pushback on it. I think it's a really good idea. I'd rather be traveling on a plane with a bunch of people I know who have been vaccinated and are taking steps. In Mexico, it looks like before you enter any establishment, go out to eat, they have you, they take your temperature and then they have you step in this liquid that sanitizes your feet. And I was like, why are they doing that? I was like, the droplets would fall on the ground and you could drag them into these places. And I thought, well, each place is taking their precautions, but if you had to have a vaccine passport in Mexico, pretty much there would be no business because, like you said, only 1% of the people in Mexico have been vaccinated. So also something to remember is that there's been a move in the whole United States to change identifications into the real ID. Minnesota is on, they're supposed to have all of this done by October. It's hard to get. It's harder than a passport to get a real ID.
Yeah.
And you won't be able to step on a plane without that, a real ID. So you can't just use your driver's license. If you have a passport, you can. But the states are implementing this real ID. I don't know if they'll still do it when they said they were going to because of the pandemic. But it's another layer of what you need to get in order to be able to travel someday again.
And, in the United States specifically, because of our high numbers and the fact that people weren't taking as many precautions, we have the highest incidence of illness and death. Americans have been barred from traveling almost anywhere.
That's right.
Except for Mexico. And guess what? Just as soon as Biden came into power, first thing that happened was the United States implemented a new rule for travel for Americans to Mexico, one of the few places they could travel in the whole world. You have to have a negative COVID test before you come back.
Yeah.
So it's one of the reasons Ted Cruz couldn't come back from Cancun right away.
That's right. He couldn't skate back quickly.
Because he had to go find a COVID test to take a COVID test and prove he was negative. And if he had been positive, he would have been stuck in Mexico for 2 weeks.
Yep.
He would have had to stay there. Now, can you imagine if you're going off to a vacation to Mexico, the only place you can go, and now you're going to have to take out a whole day out of your vacation. Maybe your vacation was only going to be a 2-day vacation or whatever it was. But one of those days is going to be going to find a COVID test, going standing inside a clinic with a bunch of people that could be COVID positive for all you know, and then waiting for the results and hopefully getting a negative so you can return home. Otherwise, having to make accommodations to stay in Mexico for another 2 weeks.
Yep.
I can tell you lots and lots of vacations to Mexico have been canceled.
That's right.
So this is going to be a hardship economically for Mexico and for the United States in terms of access to vacationing, travel anywhere, until we get vaccinated and fix this issue. So folks, get your vaccination. Like Dolly said, don't be a chicken something. Don't be a chicken stoop. You know, get out there and get your vaccination shot. Yeah. And look out for your neighbors. Look out for your family members. Look out for the people out there that may not be as technological or they don't have an internet access as good as yours. Heck, just do it to check in on your loved ones and neighbors. Do it for the community so that we can get vaccinated sooner and get back to some kind of a new normal. That's all I have for you today here on A Mexican Crossing Lines with your hosts, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM KPPP LP Fargo Moorhead, where we are adding local color to your airwaves. Good night. God bless. Get vaccinated. Keep washing your hands and wearing your masks. And we'll see you next time right here on 88.1 FM. Good night, Duke.
Good night, Cindy.